Next is a study on visual evoked potential changes in patients with type 2 diabetes mellitus by Dr. Rakhi Sen.
Good morning, everyone. My study on visual evoked potential changes in patients with type 2 diabetes mellitus. Mainly, the study was done to assess the diabetic visual pathway impairment using VEP, and VEP or visual evoked potential tests are objective electrophysiological tests for measuring how long visual impulse needs to travel from retina to the occipital cortex and evaluating functions of the visual pathway. My aim of the study was comparison of visual evoked potential changes in patients with type 2 diabetes with those with non-diabetic patients, and whether there was any association with duration of diabetes, NPDR, or control of diabetes, if any. The study was a hospital-based cross-sectional comparative study over a period of 1 year, which included 100 subjects at NRS Medical College and Hospital at Kolkata. The inclusion criteria were two groups. With one group was type 2 diabetes mellitus patients, and the other group was healthy non-diabetic, age group 35 to 60 years. Exclusion criteria: any disease that hindered VP reports, such as demyelinating diseases, PDR, visual acuity less than 618, cataract, glaucoma, optic atrophy. The parameter study were general examination, complete ophthalmological examination, blood sugar levels, duration of diabetes, complete history, HbA1c levels, IOP, and visual evoked potential changes of the pattern reversal method. Mainly the values of P100 latency in milliseconds and amplitude of P100 N75 in microvolt were used. 100 patients were selected from the OPD of the age range, as I said, 35 to 60 years. They were divided into three groups: 50 healthy non-diabetic control group, and 25 diabetic subjects without any diabetic retinopathy, and 25 diabetic subjects with NPDR, but vision better than 618. All of the subjects underwent neurological examination and VP recording at the neurology department, at the neuromedicine department, and ophthalmological complete checkup with refraction and fundus examination was done in the ophthalmology department. This was the checkerboard pattern with the red fixation point by which the VP was done in each eye. Going to the results, as we see, the latency has significantly increased from the control group to the diabetic patients, and further the latency increases, that is the time required for the impulse to travel from the ganglion cells to the occipital cortex increases in diabetic patients, more so in case of patients with NPDR. The amplitude has decreased in the diabetic and the NPDR groups as compared to the control group significantly. The duration of diabetes also affects the results. As the duration increases, the latency increases. The result analysis shows latency of P100 wave shows statistically significant increase in type 2 diabetes subjects than controls, in subjects with poor control of diabetes than those with good control, in subjects with retinopathy than those without retinopathy. The amplitude also decreases significantly in subjects with type 2 diabetes. Now, the conclusion of the study is it shows the importance of neurophysiological tests like VEP in diagnosing optic pathway damage in diabetes before the appearance of retinopathy. Pattern reversal VEP parameters like P100 latency, which are highly reliable, reproducible, and non-invasive tests, could be useful in predicting post-operative visual prognosis in patients who have normal fundus findings. These are my references.